So we know that the pre-transplantation period is characterized by depression, anxiety, which is linked to waiting list, a long time, and operation. Nevertheless, after the transplantation is not always perfect, as the polls show. There is an impact of surgery. You have to modify your lifestyle. You have to take a lot of treatments. Sometimes you have to deal with a post-traumatic stress disorder, and somebody speaks about survival guilt post-liver transplantation. So our suggestion for this part, don't stay alone, because you are not alone in this long way that we go after liver transplantation. So we can look for a solution.
I think I exhausted myself a lot of the time trying to be. I had a 6 and 8-year-old child and a husband that thought I was going to die and didn't know what to do with himself. And I exhausted myself trying to tell everyone I was okay, but I don't even know if I was okay. But having to sort of deal with everyone around you can be very exhausting, I can assure you. And I'm sure a lot of people hearing me say that will identify with that one.